My name is Steve Ashkin. I'm the Executive Director of the Green Cleaning Network and President of the Ashkin Group. And it's my pleasure to introduce this webinar for you today. And it's going to be the first in a series of webinars relating to greening the cleaning industry. It's my overall goal to make it easier for facility managers to implement green cleaning or to improve an existing program, and to help those suppliers who are on the phone to identify the needs of the leaders in the field so you can generate the best return on your R&D, sales, and marketing resources. And today, we brought together what I consider are the 4 leaders in the industry. And what we really want to be able to do is to provide you with insights into what these folks are working on in the key sectors. So if you're dealing with schools or hospitals or office buildings or sporting venues, this is a real opportunity for you to get to learn who they are, to learn about their programs, to understand what they're thinking about relative to green cleaning, and perhaps most importantly, how, whether you're a facility operator or a supplier, how you can more fully engage these organizations to drive success within your own organization. I also want to point out that this is a 60-minute presentation, so we have the 4 speakers, and you can see them on the screen. But we will also have an additional time for questions and answers at the end. So I want to point out that there's a chat feature on the bottom right-hand side of the program, or of the GoToWebinar. And please enter your questions in so that we can make sure that we can do our best to address the questions that you have. I also want to encourage you that when you listen to each of the 4 speakers, that if you want them to get in touch with your organization, go ahead and just enter in a question for them to get in touch with you. We want to make this absolutely as efficient and effective as absolutely possible. So let them know what you're thinking, what you want, how we can work together to make a difference, not only protecting health and the environment, but to drive more success in everything that we do. So today, we're fortunate to have Mark Bishop, who is Vice President of Policy and Communications with the Healthy Schools Campaign, Janet Brown, Director of Facility Engagement with Practice Green Health, Martin Toll, who's the Executive Director of the Green Sports Alliance, and Sarah Cederberg, who is the Manager for LEAD at the U.S. Green Building Council. And I have to tell you that I personally know all of these folks. They are amazing people. They work for amazing organizations that are extraordinarily influential, and I really believe that you're in for a real treat. So with that, let's get started. Before we turn it over to Mark, who's our first speaker, Alex, would you push over a first question that we'd like to ask of all of you? So real quickly, what we want to do is just ask a few questions throughout the presentation. So the first one is, would you just simply let us know who you are? Click the one, obviously, that represents what you do, and we'll just take 30 seconds to do this, and then we'll get going with our first speaker. All right. Okay, so, you know, and I really do this, frankly, to help the speakers so that you folks understand who's on the line, and please try to be helpful to everyone. And as you see, we have a broad cross-section of attendees, and I think that all of you who are on the phone will get a lot out of the presentation. So thank you, and Mark, let me turn it over to you, and I appreciate your time today.
Great. Thank you so much, Steve. I really appreciate all the work that you've done for Healthy Schools Campaign and for the industry as a whole. My name is Mark Bishop. I'm Vice President of Communications and Policy at the Healthy Schools Campaign. We are a not-for-profit organization. We're located in Chicago, and we work on the policy and programs around school health environments, whether it is improving nutrition standards for the foods that we serve in our schools, all the way down to the facilities and the questions about chemicals that we're using in our schools. We try to develop programs on the ground as well as supportive policies to make sure that healthy students can ultimately achieve in their schools. Specifically around green cleaning, our program started about 8 years ago as a pilot project with the Chicago Public Schools, and it very quickly expanded to our publication of the Quick and Easy Guide to Green Cleaning in Schools. Today, we've distributed over 125,000 copies. It is a broad effort that engages manufacturers and distributors and as sponsors and participants in helping us develop the content. Many of you, I believe, are actually on this presentation today, as well as engaging over 25 national organizations, all in primarily education and parent leader groups, to help us get this information into the stakeholders who value healthier environments and better educational outcomes for our kids. So together, we're trying to make a change at the local, at the state, and at the federal level, and also use this to leverage policy change across the country. But I want to talk about one specific program that we work on, and I want to talk a little bit about our Green Cleaning Awards for schools and universities. This is a project that's done in conjunction with the Green Cleaning Network, American School and University, as well as us at Healthy Schools Campaign. You should know that the 2013 application is up at the American School and University website. But more importantly, this is a 5-year-old program so far that uses the Quick and Easy Guide to Green Cleaning as the basis for competitions around green cleaning programs in schools. And what this has actually done from us is not only provide a platform to talk about and highlight success stories around the country, but has given us a robust data set to really think about what's going on in schools. And recently, we've taken a look at our applicants from 5 years ago and comparing it to what's going on today with our applications in our winning schools. And it's amazing to see the change. So what I want to talk about today is a little bit about the trends of what we see in green cleaning in schools, and not just what's happening, but what's happening at the top level programs. When we're thinking of leadership, and we're thinking of schools that are really trying to push the cutting edge of green cleaning, what are they doing? And there are 5 main categories that we see. And they fall into training, chemical selection, process, communications, and evaluation. And I'm going to take a little bit of time to go over all these 5. And then at the end, if there are any questions, we'll be more than happy to go into more detail. Starting about training and investing in people. One of the things that we see is that the top green cleaning programs, whether at a grade school, at a district, at a university, realizes that the biggest challenge and the biggest opportunity is making sure we have a well-trained workforce. I would say every application that we received highlights and focuses on what are their training opportunities for their staff. Training, ongoing professional development, as well as specific training around green cleaning. So they can take a workforce, they can professionalize it, and make sure they are implementing the programs that are going to be sustainable and effective in their schools. At the university level, it gets even more interesting. Temple University was this year's winning application. They established a school of custodial services, a training school just for their custodians, and they gave them over 5 days of professional development every year just to focus on how you can do your job better and more sustainably, focusing on issues of how to use microfiber properly, how to look at the use of personal protective equipment, looking at how what are the proper ways of using the chemicals that we purchase and do it in a way that's safe, that is safe. So again, I think it's very important and very interesting to think that investing in our people is a top priority in an effective green cleaning program. The second trend that we're seeing is looking at the chemical selection and looking that now it's beyond just certification. 5, 6 years ago, when our green cleaning programs were early on, making sure that schools were using certification certified products was the most important thing that we can do. What we've learned is we've gone beyond that. Certification has gone from what we need schools to do to what schools are doing. And now we're trying to figure out how to go beyond it. So we are looking at schools who are leading the way by eliminating entire classes of chemicals. Many of the schools that are on the awards application, they've eliminated entire classes, particularly strippers. We're seeing many schools moving towards mechanical stripping rather than chemical stripping to reduce the exposures, as well as use more efficient processes. Also, certifications for many don't always do enough. Certifications are important, but in some areas we don't have certifications. In some areas we think we can still do better. Specifically, we're seeing a lot of schools that are going to their MSDS sheets and starting to look at what is in the content and really trying to drill down into the data. Specifically for disinfectants, we're looking at all of our Green Cleaning Award winners in the past year have used disinfectants that have a health safety ratings of 1. So they're really trying to drill down to get the safest products available for the use of their staff. And then I think this is something that's pretty commonly accepted and commonly known, that green cleaning, you really are going to be reducing the ultimate chemical, the number of chemicals that you're using by using dilution control systems. And on average, the average school who is taking lead in green cleaning is using no more than 5 chemicals for their general use. And then even, I think one thing that's really emerging and is really interesting is the use of non-chemical technologies, in particular water-based technologies, whether it is, and there are a lot of technologies out there that are emerging, and I think a lot of them are very interesting for us to continue to explore. This is more common what we're finding at the university level than the K-12 because of some of the capital purchases required. However, we're definitely seeing this movement towards taking some of the chemicals and moving them towards water-based, whether it's steam, ozone, or water that has with electricity run through it. So we'll keep going. The next thing that we are seeing more and more of is looking at standardization of process. The most common, I would say that most commonly we're seeing ISSA's SIMS GB program. A number of the schools had applied for and received SIMS GB certification. One school that has Green Seal certification. There was a school that was working with process cleaning for health. And regardless of which program schools are using, the story is that schools are recognizing the need to standardize their process, use externally validated systems and processes, and be able to train their workforce and use their workforce in a way that they can efficiently accomplish the tasks at hand. And a lot of these standardized processes are allowing them to do that. The next thing is that we're seeing is communications. We like to talk about green cleaning, and we like to make sure that green cleaning is more than just swapping out chemicals and changing how we move a broom down the floor, but it's about engagement. We are seeing green cleaning programs in schools across the country that are really taking that step to be more than just a custodial service. They're trying to provide value added to their community. And they're doing that in many ways, whether it's built by engaging through newsletters and communications to tell people what we're doing, why we're doing it, but also be part of their greening of their school team and show relevance to the school community. Be part and engage with teachers and administrators to say how we can be partners in a healthier, cleaner, more sustainable school environment. Poster contests with students and identifying strategies to get students engaged and interested in why we're doing the things that we're doing. So we're seeing green cleaning programs to go beyond just the confines of a custodial program and really be engaged and active in the school communities. And that's also becomes really helpful as we're thinking about budgeting processes and making sure that people are aware and administrators are aware of what the value that we are adding to the schools. Sometimes these communications programs are driven by a distributor, sometimes they're driven by in-house groups, sometimes they're driven by a green team. But regardless, there's value that's being added to the school community wherever it originates. The final trend that we are seeing is the evaluation of the program. And I would say this is the one that's probably in the earliest stages at this point. But we are absolutely seeing schools that are making efforts of taking it beyond of just saying, well, we're going to provide a clean program, but we are going to actually show you how it's clean. Again, early stages, and we don't see consistency across the board yet, but what schools are doing, surveying of occupants, doing APA analysis or similar type of in-house analysis, looking at their waste streams of have they cut back on paper use, looking at purchasing analysis and are they able to drive down costs of some of the systems that they're using, looking at the chemicals over a period of time, and are we able to actually reduce the number of toxic chemicals? Are we able to reduce the quantity of chemicals that we're bringing into our schools? Looking at health records and kind of trying to make that connection between a healthier environment, lower absenteeism, better learning environment for our students, and trying to tell the story of clean buildings through occupant health. And then one thing that we are seeing in some places is some limited use of ATP testing. This is, I mean, I think this is exciting. But a lot of schools are starting to do this and wanting to say, we are going to show you the data of how this is clean. So again, we're really interested in seeing where this goes, but there's no question that every school that we are seeing that's leading the way is grappling with this issue of evaluation, and they're working hard at it. So if I were to answer the question of what I see is next, and these are the 4 areas that I'm looking at chemical selection. I mentioned Transpare here. ISSA has a program that will allow us to look at more a detailed set of what is in a chemical, not just what is in a chemical, but the environmental and health attributes. I think this can go a long way towards helping purchasers make decisions about the values that they want to state in the purchases that they're making. Non-chemical technologies, they're still pretty pricey. Looking at some of these water-based systems, I think it's going to be really interesting where these are going, but there's no question that there's a lot of interest in these type of systems. Process, there's going to be, I definitely see more and more consistent process being implemented in schools. From a school setting, I am seeing SIMS GB more than anything, but also LEED is helping drive this. But this is going to become more and more common as we become more and more sophisticated in our cleaning programs. And finally, evaluation. I started mentioning this, but I really think there will be a lot of movement in the next 5 years in evaluation and how we talk about the success of our cleaning programs. Again, that's just a brief overview, but I would encourage anyone to learn more by going to healthyschoolscampaign.org or our quick and easy guide to green cleaning schools at greencleanschools.org. And at that, I will say, Steve, thank you. And if anyone has questions, type them in, and I will look forward to a discussion. So, thank you, Steve.
Thank you, Mark. I really appreciate you taking the time. For those of you who are on the call who are not familiar with the Healthy Schools campaign, in my opinion, they really are the movers and shakers in this sector. They have been wholly responsible or largely responsible for the green cleaning in school legislation that have been passed across the country. And it really is a great organization to get to know, to get involved with. And again, Mark, thank you very much for the work that you do. Alex, do we have another poll question before we move on to our next outstanding speaker?
We do, Steve. We are launching it right now.
Okay, great. So all of you on the phone, please take a minute. And especially those of you who are service providers, let us know what sectors that you work on, and we will close the poll in just a few seconds, and then we will get on with the presentation from Janet Brown, who is the Director of Facility Engagement at Practice Green Health. Well, that's great. Well, thank you. And for the speakers, these are the people who are taking care of your facilities. So, we really have a lot of good opportunities to really help them really continue to not only drive their green programs, but also to provide better services to your members as well. So with that, let us turn the microphone over to Janet Brown. One of the things that I have to say I really appreciate Janet is that she actually worked in the environmental services department of a hospital. So in addition to the role that she plays as Director of Facility Engagement with Practice Green Health, and I hope, Janet, you'll spend a minute explaining about your organization, I really appreciate the expertise and the direct engagement that you've had, which really makes your program so outstanding. So with that, Janet, would you please take over? And again, all of you on the line, if you have questions, please type them in, and we'll make sure we get to them at the end of the presentation.
Thank you very much. I'm very happy to be here, and it's nice that I'm following Mark and see so many synergies between schools and healthcare. Next slide, please. So my name is Janet Brown, and as Stephen mentioned, I come from healthcare. I worked at Beth Israel Medical Center in New York City for 13 years, and for the past 9 years or so, I've been working for a membership-based organization called Practice Green Health. And we are a community of hospitals, other care providers, and businesses that are working together to improve the environmental performance of the sector. There are many synergies, and I'll build on Mark's. But first of all, it's that every worker, patient, and visitor has a right to a respectful and healthy environment, or what we call a healing environment, an environment that is reduced stress, is improving safety, and is contributing to ecological health. When we talk about healthy environments in healthcare, we're really talking about a commitment to the worker. By taking responsibility for the materials, the resources that we use in healthcare, we're demonstrating a commitment to human health and the environment. So we think of the environment in healthcare as directly where a patient is cared for or in any of the departments within the hospital, but we also know that the activities that take place within that healthcare environment do not stay there. They go into the community and into the global environment. So a commitment to healthcare sustainability is a commitment to the planet. We recognize the connection between human health and health of the environment, and I'm happy to say that we're seeing a lot of movement in healthcare and more engaged leadership than ever before in creating healthier environments. Next slide, please. In this next few minutes, what I'm looking forward to doing is helping introduce you to the community of healthcare sustainability and some of the trends that we're seeing right now. We get our foot in the door with healthcare sustainability with cost savings, and we can all be very thankful that in the process of doing more with less, we save money for hospitals. We help them see that we can improve efficiency, increase regulatory compliance, get some positive press, and do the right thing at the same time. But right now, one of the trends we're seeing is around wellness and sustainability. I mean, with accountable care, healthcare and what it looks like as a moving target, it actually always has been. It's constantly changing. But we are seeing an increased awareness around prevention, thankfully, wellness, and staff engagement. And where there used to be a concern of not wanting to ask employees to do another thing, now there's more of an interest that workers want this. Workers are looking for recycling programs. They want to be told to shut off the light. They don't want to leave their personal values at the door. So now we're seeing that sustainability is something that actually engages the worker. It's something they want to see. And that is also starting to be translated to the patient. Patients want to see that their place of healing is actually in line with their personal commitment to health and wellness. Next slide, please. So Practice Green Health really is about creating an environment where we can educate, motivate, and celebrate environmental excellence in healthcare. And I think similar to schools, what we're seeing is that the hospitals can't do it on their own. They're very busy. People are wearing multiple hats. There's a lot of challenges in the healthcare environment, and they are looking to their business partners as that, partners. They're not just looking for a vendor. They're not just looking to get their product in. They're looking for a partner. And so that means, yes, they want the material or the product or the service that but they also want help with training, education, signage, participate in Earth Day activities, for example, and even reporting and data collection. Next slide, please. More and more hospital leaders are having their personal aha moment. They get it. Okay, so if we're a healthcare facility, we need to demonstrate our commitment to human health and the environment. What can we do about that? So today we're talking about green cleaning, but in the community where I work, it also includes things like green building, transportation, grounds and landscaping, healthier foods, less waste, energy conservation, and all of these things. And as hospitals more and more realize that sustainability initiatives help them achieve their goals in a multitude of areas, the more they're able to operationalize it and integrate it into the way they run their hospital. So while hospitals still very often have green teams, and that's something that's in most of the hospitals we work with, we think over time they'll be able to integrate the sustainability criteria into their existing committees so they can do away with green teams and more have it a way of doing business. Next slide, please. But still, right now, most hospitals do have a green team where they're just getting things started or they're somewhere in between. There is no perfectly green hospital. Even our top performers in our sector are never finished. There's always more things to do. Very challenging in healthcare, 24/7 operation, constantly changing staff, lots of regulations, financial challenges. It's not an easy environment. But hospitals are making a lot of progress, and the businesses that are keeping up with that interest are those that are going to be around for the long term. Next slide, please. But guidance is what hospitals seek. It's very confusing, especially with the greenwashing going on right now, where businesses will come in and say that they're quote-unquote green, but hospitals are getting educated about how to articulate their needs so that they're sure to get the materials that they're asking for. As we go to our next slide, I'll follow with what we heard earlier around the need for standardization. Joint Commission is the accreditation group that healthcare is familiar with. So Joint Commission is looking for standardization. We really advocate for standardized set of questions that purchasers can use, not only for cleaners, but for lots of things that they buy, to reduce toxicity, to improve energy and water performance, to prevent waste generation, to have take-back programs where helpful, and to have standardized methodologies for reporting. Next slide. We are looking for externally validated resources like Green Seal Certified for Cleaners or EcoLogo, to name a couple. Practice Green Health, a membership organization that I work for, has a host of case studies written up on win-win strategies that are in healthcare right now. We also have specification language for a variety of products and services. If you can squint your eyes, you might be able to read some of them on the screen there. So we certainly have them for green cleaning, but we really help to infuse environmental specifications for a variety of materials and products you would find in healthcare. Next slide, please. A lot of the hospitals also work with group purchasing organizations, so it's very important for manufacturers and service providers to go through those group purchasing organizations to get into the hospital supply chain. We also have a supplier directory, next slide, which is a great way for you to get your voice out to our community. We have a business membership program. That's a way to be part of the community, be part of the conversation, be part of the solutions. Next slide. Just like we heard from our other speaker, we have an awards program from Mark. So we give a variety of awards for celebrating progress on sustainability. And next slide, we take the data and we put it out in the form of a benchmark report. And this is where I can report to you some of the trends that we're seeing around green cleaning. I don't need to read all of them for you here. You can read the slide yourself. But what you can see from this is that we're seeing great movement in the area of green cleaning. Some of these initials you won't understand. They're different levels of awards, but just know that the ELC is our top performer. Those are our Environmental Leadership Award winners. And then the other ones are just a little bit lower down. But what you'll see is if you won an award from Practice Green Health, chances are very good that you have some kind of green cleaning program. And in healthcare, green cleaning is tricky. Mostly because, I mean, we all know that tens of thousands of people die every year from infections that they get in the hospital. So there's a lot of concern around cleanliness of healthcare and disinfecting. So like Mark was saying, it isn't just about third-party certification. It is about understanding and training and equipment and the products. The strippers, you may know that healthcare workers have the highest incidence of asthma of any sector because of these issues. So this is a very important issue for healthcare workers. Personally, myself, I would experience nausea and headaches if I was ever in the area of one of those strippers. So it's something that people are really interested in moving to a different kind of flooring that doesn't require waxing or stripping, and we're seeing that more and more. Another interesting thing we're seeing that you'll hear about in healthcare is the patient experience. This is a new title that we're hearing in a lot of hospitals, and a patient-focused model of care where even hospitals like Cleveland Clinic are starting to educate their patients on why you don't smell a chemical smell on the hospital unit, why their floors are dull now. This is on purpose. It's because it reduces falls. The lack of smell means we have a fragrance-free product. Sometimes it's not enough to do the work. We have to articulate why we're doing it because a lot of people don't always understand. So it's an opportunity to educate as well. Next slide, please. I don't want to take up too much more time. I'm going to flip through these last few ones just to let you know that we do have a report on this. Here's the link if you'd like to read about it. Next slide, please. And we have a conference coming up in April, next slide, which is everything you can imagine around healthcare sustainability, a great place to network and meet other people. And we are having a pre-conference event, a research exchange on green cleaning and healthcare. So if you'd like to be part of that conversation, we hope to see you there at cleanmed.org. Next slide, please. I also want to quickly mention a free initiative that I'm working on called the Healthier Hospitals Initiative. Next slide. Thanks to 12 sponsoring health systems, this initiative is free to any others that would like to participate. And we are asking people to sign on to a minimum of one area. And next slide. We have all the tools and resources available to ensure success. These interventions have all been already established in these 12 sponsoring health systems, and they've now been developed for any hospital to participate in. Next slide. So there is one on safer chemicals and switching to greener cleaners. Next slide. What we're asking is for people to switch to green cleaners in 90% of their areas. We're not talking about disinfecting it. We're just focusing on carpets, all-purpose cleaners, glass cleaners, and bathroom cleaners. And we're trying to send a message to the marketplace that hospitals are interested in safer materials. Next slide. I'm sure I'm running out of time now, and I want to get to our next speaker. So with that, I'll say thank you for having me. I know that was a lot of information. I hope you'll visit our website at Practice Green Health to get more of a flavor for what we're doing, the community of sharing we have there, the over 1,000 hospital members that we have, and the over 60 businesses that want to be part of that conversation. Also, please consider your involvement with the Healthier Hospitals Initiative, which is a free initiative, and then I gave you some additional resources. Thank you very much for having me, and I look forward to hearing the next speaker.
Thank you, Janet. I really appreciate your time today. And for those of you on the line, I really would encourage you to learn more about Practice Green Health if you're not already involved with them and if you participate in the healthcare sector. And, really consider, for example, participating at their Clean Med conference. Candidly, if you go, you won't see very many of your competitors there. It's one of those nice sort of secrets that are out there for a huge, huge segment of the marketplace. So again, Janet, thank you very much for your time. And if any of you on the line have questions for Janet, please make sure you just enter them in the chat box. So now before we move on to our next speaker, Martin Toll, we want to ask another quick question of you. So just real quickly, what are your thoughts on what do you think is the strongest case to be made for green cleaning? Okay, great. Thank you very much. and it looks like, surprisingly, I always expect everyone to say cost is the most important thing, but I really appreciate that we're beginning to really look at a much more holistic and, frankly, a more informed understanding of the potential impacts and benefits of green cleaning. So this is great. Thank you very much. So now let's move on to our third speaker. The speaker is Martin Tull, who's the Executive Director of the Green Sports Alliance. I've had the fortune of getting to know Martin over the last few years. This, ladies and gentlemen, is somewhat of a new organization that I think you'll be really inspired and excited to hear about. These guys really have an opportunity to really make a difference. Obviously, sporting facilities are huge in the local communities, and I think there's some really interesting and intriguing opportunities to perhaps network and work locally with the major sporting facilities, not only to drive green cleaning, but other green initiatives. So with that, let me turn it over to Martin Tull, and thank you, Martin, for being on the call today.
Absolutely. Thank you so much. Greetings to everyone on the line. This is Martin Tull, the Executive Director of the Green Sports Alliance. And I felt like since we had such great technical presentations from our other presenters, that I would give you a little bit broader context for some of the way that we're thinking about green cleaning within the other aspects of sustainability that we're working on as an organization. If you'll go to the next slide. Like you, many people throughout the country pay a great deal of attention to sports. And in fact, less than 20% of people pay attention to science, and over 60% pay attention to sports. There is some special magic that happens at games, and we're using a lot of the power and the energy of those sports venues to look at how we can engage both with vendors that work with the facilities, the facility operators, the team representatives, and then eventually the fans themselves as well. Next slide. So the mission of our organization is to enhance the environmental performance of sports teams, venues, and leagues. We are also a nonprofit membership-based association. We have, if you'll go to the next slide. The Alliance today consists of over 160 professional and collegiate sports teams and venues from about 16 different leagues. And we've grown over the past few years from our founding of 6 teams in March of 2011 to quite a large and powerful collaboration between sports leadership, sports executives, teams, industry partners, and committed environmentalists like the experts on the call today, trying to learn and understand what works around adopting sustainability practices in sports. Sports is a unique space and requires different tools than other facilities. And we're working very closely with our partners to understand the business case for many of these practices. Next slide. We're also trying to really understand what's possible, and there are many great examples underway from leadership throughout the leagues, both in higher education and in professional sports. Some of them are quite big ideas. The next slide. Ohio State's initiative looking at zero waste for their entire football stadium. There are many big, bold ideas out there in areas of environmental sustainability with very few complete, holistic sustainability strategies in place. And one of the things that we're looking at doing around green cleaning is to take that as a specific issue to be able to work with our teams and members on, as well as work with our industry partners, and have that be a nested component of a larger sustainability strategy. Next slide. We do have some tremendous examples of success. This is a slide from the Seattle Mariners looking at in essentially less than 7 years, they've been able to go from a 10% waste diversion rate to nearly 90%. If you'll go to the next slide. Specifically in green cleaning, some of the things that we've learned from our members, many of them have made it a priority internally, working with their vendors to adopt policies to be able to ensure that green cleaning solutions are being employed by their vendors. We have worked with our members to develop a operations roadmap. One pillar of that is adopting a green cleaning policy, along with energy, waste, water, and other fan engagement strategies that are included there. We'd be very interested in working with any of you that are vendors or service providers to better understand the tools and techniques and strategies that you have at place with many of those sports facilities, so that we can include those in future versions of our appendix for the roadmap. Many of the vendors that our sports facilities are working with are actually making it quite a bit easier for them to adopt these green cleaning techniques. One sanitary supply company from the Northwest has created a green spend spreadsheet where they basically do the analysis for the team around which products they're purchasing, which ones have some form of certification, and then giving them actually a scorecard of the percentage of their products that they're purchasing that are certified green cleaning products. So I would say to any of the vendors on the line, certainly that type of participation, deeper participation with your clients is useful. And as was mentioned on both of the earlier presentations, I think sometimes the facility operators really do need that extra bit of assistance to make these techniques introduced. We also have heard from a number of our members that the products are just basically getting better. We too have heard great stories of success of some of the water-based products, as well as a number of other certified products. So it's much easier for us to talk about the products that are available, since they really are at par with other products these days. We as an organization still need to work with a number of partners and do additional sports facility specific research. So we're very interested in working with you on that. If you go to the next slide. We'd really like to try to identify additional products and solutions that you've already been using at your facility, if you're a sports facility. If you're a cleaning provider, we would love to be able to identify specific case studies from sports venues that we can package and submit to our members. We also host a monthly webinar series. Very interested in being able to tell these stories to our members. We would love to have you involved in the Alliance more in an ongoing way. If you're a sports facility or a team and not yet involved, we'd love to have you as a member. If you are a company or a service provider, I'm happy to discuss how we can partner around some of these environmental sustainability initiatives. We also host an annual conference. This year it'll be in New York City, where we bring together hundreds of sports executives. Probably likely over 60 teams will be represented there. And the 2.5 days is designed to focus on all aspects of sustainability, including green cleaning. So we would love to have you join us for that as well. With that, I think I will go ahead and turn it back over to the group, and we can dive back into some of the technical details. But the offer is there. We'd certainly love to work with you at a facility level, at a manufacturer level, or at a service provider level to better integrate these techniques throughout sports facilities. So thank you very much.
Martin, thank you very much for taking the time today to be on the call. I really appreciate it. And for all of those who are on the phone, especially on the supply side, I have to tell you that going to the Green Sports Alliance Summit, I'm going to use a word that we don't often hear in business. It's fun. I mean, not only does it have a good opportunity from a business perspective, and certainly, you know, as Martin talked about, being able to really capture people's imaginations through the magic of sports. But it really is just fun with the energy and the people that you meet there, especially if you're a sports fan. So it's something, again, that I'd encourage all of you to consider. They're a great organization, and they are definitely going someplace. So before we move to our fourth and final speaker, let's do one more polling question. Our next speaker is Sarah Cederberg, who is a manager of LEED for the U.S. Green Building Council. And I have to say that I'm really delighted that Sarah could be on the phone today. She specifically was the person who helped manage the revisions to LEED-EB relative to the cleaning credits. So this is a great opportunity for all of you who are on the phone who are very interested in LEED. I think you know that it's being revised, and I hope Sarah will go through and talk about what's happening with the council, where it's going, and still provide some information about how you can get more engaged with the council. So thank you very much. And from our polling questions, it looks like, as you can see, that 75% of the audience is sort of thinking about and using LEED to help drive green cleaning, which frankly is pretty remarkable. So with that, Sarah, you're up, and thank you very much for being with us today.
Sarah?
Oh, sorry. I was on mute. Thanks, Steve, for that introduction. I hope that we can work on moving that last 25% over into the other columns. So thanks, everybody, for having me here today. I want to go through a bit of the background on the development process for the next version of the LEED rating system, and then dive into some of the details specifically around the changes for the green cleaning credits. The U.S. Green Building Council is a nonprofit. We are located in Washington, D.C. Our main product is the LEED rating system, but we also have a host of education resources and a small advocacy group. LEED is an industry-led and consensus-based rating system. We work with a wide variety of stakeholders from our member companies. We currently have about 12,700 member companies and 77 local chapters across the country. Where LEED is right now, we have certified projects in over 120 countries in the world. Our projects, about 40% of the square footage of our currently registered projects are international. So a huge emphasis in the V4 version of LEED has really been placed on making sure that we're making global standards and that we are creating one common metric for defining green building around the globe. Our reviewers over at the Green Building Certification Institute are very busy. They're certifying about 1.6 million square feet a day. And you'll see here on the slide, over the last couple years, we've noticed that over half of our projects earning certification are earning LEED Gold, which is great. Wonderful work, everyone. But it's our signal that perhaps it's time to raise the bar and to make the rating system a bit more stringent. Next slide. So to do that, and this is a diagram that kind of outlines the continuous improvement cycle for the rating system. This roughly estimates kind of where we see when we need to be updating the rating system. Eventually, we want our LEED certified projects to not just be doing less bad, but we really want them on the other side of the zero impact bar, and we want our projects to actually have a positive environmental impact. So generating their own electricity or cleaning the air around them, really giving back instead of just doing less. And you'll see as green building codes become more and more standard, or policies like we heard about the green cleaning policy for schools become more and more institutionalized, that gives us the opportunity to really maintain the L in LEED. We are a leadership standard, so we want to make sure that we're always one step ahead of where code is. So how do we do that? In version 4, This is the first time that we really introduced these 7 impact categories. What you see on the screen are our organizational priorities for what we want LEED projects to be really good at. So first and foremost, we want our buildings to reduce contribution to global climate change. But then right up there also, we want to make sure that they're enhancing human health and well-being. Some of the new impacts that we're really trying to address more directly in the rating system are towards the bottom of the list. So we're trying to figure out what it means to build a green economy, what those green-collar jobs look like, and how we can have a larger effect on the community as a whole. So when we go through and write new credits, we're looking at all of those impact categories to kind of understand how well the requirements address each of those 7 sections. And something else you'll notice in the next version of LEED, we have branched out into more market sectors. Starting in 2009, we had a few small working groups of experts come up and identify where the major barriers to entry for these project types are, and also understand where these buildings have the largest environmental impact. So for example, warehouse and distribution centers obviously have a lot of transportation energy associated with their shipping. So we tried to modify the rating system in specific places to really to get the most environmental impact and also kind of make the rating system more accessible for these project types. What that means is that we now have 21 rating systems, but they all roll up under those larger headings of building design and construction, interior design and construction, existing buildings operations and maintenance, neighborhood development, and homes. So in the existing buildings rating system, the one that you all are probably the most familiar with, you'll also notice in LEED v4 that we've added these establishment and performance headings in all of the credits in the rating system. This is our way of really addressing or recognizing, I guess, the way that our project teams approach LEED EB. We know that in order to kind of set yourselves up for performance down the road, you need to get all of those policies in place, kind of line everything up, get everyone ready, and then really begin the actions associated with those policies. So in practice, that means that we will be offering a split review for version 4 so that project teams can get those policies and assets reviewed up front and make sure that there aren't any mistakes or oversight there before they begin tracking performance. And then when projects come in for recertification, we would just be checking in on your performance criteria. The existing buildings rating system is the only rating system that does have an expiration date. So your plaque does expire after 5 years, at which point you would need to come in for recertification. Next slide. So if you have not been tuning in, which is fine, we have gone through 5 public comment periods at this point on v4. Our first public comment was back in 2010. We've gotten over 22,000 public comments that we've read and responded to. And about a year ago, our board made the decision to delay launch of the rating system 1 year to make sure that we have all of the tools and resources in place to really support our project teams from day 1. So we will be going to ballot in June and then launching later this year in November. But we will be allowing projects to choose between LEED 2009 and LEED version 4 through June 2015. That means that you can still register for 2009 for another 2.5 years. To help us really test out the rating system, we've also started a beta program. We're trying to get 100 projects enrolled. We have about 65 currently enrolled to really help us refine our reference guides and LEED Online forms over the next year to make sure that everything's really in sync and giving you the information that you need before launch. And lastly, I'll touch on public comment at the end of the presentation. So next, I'd like to get into a little bit of the detail around the green cleaning credits in LEED version 4. All of those are still under the indoor environmental quality section of the rating system. And this is the section that I work on the most. And part of the weighting process that I touched on with the impact categories really helped us to clarify the intent of this category. We're really focusing on these 4 buckets for our credits. A lot of the green cleaning credits kind of cross those lines. Obviously, they're related to air quality, but also occupant experience. Next slide. So, some changes that you'll see. If you're familiar with the current version of LEED 2009, hopefully this slide will be helpful, but I'll walk through each of the policy prerequisite and the related credits for version 4. So in the next version, the green cleaning policy is very similar to the 2009 requirements with a few notable changes. We now have 2 options in this prerequisite. The first option makes sense if you have your own staff. It's kind of a user-generated policy similar to the 2009 option. We have added a requirement for measuring the impact that cleaning practices have on energy, water, and chemical use. So similar to what we've heard in some of the other presentations, we'd like our service providers to really take on that accountability for understanding the volume of chemicals being brought into a building, or the effect that making sure all of the lights are turned off at night and using cold versus hot water for some cleaning, and really trying to start to measure the contribution that your work has on the overall performance of the building. We've also added a second option to the policy prerequisite to kind of ease the documentation burden. We recognize that Greensill 42 or SIMS GB are roughly equivalent to the policy that we would ask you to write from scratch. So this is a faster way to kind of make sure that your service providers are giving you the quality level that you would get from doing your own policy, for writing your own policy. We've also combined the credit that was the high performance cleaning program in LEED 2009 into the policy. So in addition to having the policy, we're asking you to implement it. We did that for a number of reasons, but mostly because it was the highest achieved credit in all of our LEED EV projects to date, consistently being earned by over 95% of our certified projects. Then I will jump down to the other kind of related credits. For the custodial effectiveness assessment, we are keeping the APA requirement, but we've lowered the score from a 3 to a 2.5. We've also tied that credit to the implementation of the high performance cleaning program. So again, making sure that you're implementing the policies that you have in place. And then on the products and material side, we've raised the bar fairly significantly for the amount of purchases that need to be made to qualify. So we've raised the threshold from 30% to 75%. We've also recognized a few newer programs like the EPA Design for the Environment label, as well as Ecoforum's Transpair that we heard about earlier. And for our projects outside of the US and Canada, we're looking at the Global Eco-Labeling Network standard to kind of govern other international Type 1 labels. And then lastly, the equipment credit is open for 6 public comment. Here we've raised the threshold from 20% to 40% and added in a provision for a phase-out plan for equipment that might not have yet reached the end of its useful life. All right, next slide. So this is kind of a scary diagram, but on the left you'll see the LEED 2009 credits. On the right are the LEED version 4 credits. Green would indicate a credit that hasn't changed. Yellow is a slight modification, and red is a major change. So this is, I think the main takeaway here is that the list on the right is shorter than the list on the left. And if you're looking for where some of those requirements may have landed, like the high performance green cleaning program, you'll see that that has now been rolled into the prerequisite. Okay, next slide. As I mentioned, we are trying to find beta participants. So if you think your project, if you're working on a LEED project right now that you think may be a good fit, We'd really appreciate the feedback that you guys can provide us on our new reference guide and forms. We will also be recognizing all of these projects at Greenbuild in Philadelphia this year. Greenbuild will be in November. I believe it's the third week from the 20th to the 22nd in Philadelphia. If you're interested, reach out to Steve or me, or you can email my colleague, Chrissy Mackin. Her email is up on the screen. All right. So lastly, a few different ways for you all to get involved and engaged. As far as our balloting process for LEED version 4, we do a small voter registration, sort of our own electoral college. So if you would like to be part of the consensus body, the group that actually does the voting on behalf of the entire membership, you do need to be a USGBC national member company. The deadline for that has passed, but if you are already part of a member company, please register in the month of April. We'll be doing some kind of targeted webinars and education about the changes in version 4 before ballot opens up in June. And then if all goes well, we'll be launching LEED version 4 in November. And then lastly, if you would like to provide comments on the equipment credit, please look at our website, new.usgbc.org/LEEDv4, and you'll see there are links to the specific credit changes and a little bit more information. All right. Look forward to your questions. Thank you.
So Sarah, thank you very, very, very much for your time today. For those of you on the call, I think you know that LEED has played an enormous role in driving the green cleaning movement, but you also see that there's a lot of changes taking place, so that also means there's a lot of opportunities to help the various projects and building owners and teams with the updated green cleaning requirements. So again, type in any questions that you may have. And Alex, do we have another polling question, or are we ready to get into the questions and answers?
Steve, we're ready to get into Q&A.
Okay, so in that case, Alex, would you please go through your list? And I think we're going to stay online for 15 minutes or so. And why don't you take it away, Alex?
Great. Thanks, Steve. Thank you, everybody, for sending your questions. Please feel free to keep sending them in as we ask our presenters them. So the first question is for Mark Bishop. How can we become involved in the Quick and Easy Guide to Green Cleaning in Schools, and how do we get copies?
Those are actually easy questions. Either way, to get copies of the actual guide, you can go to the website greencleanschools.org and type in fill out your information, and we will be happy to send them to you. Or just send me an email, Mark, M-A-R-K, at healthyschoolscampaign.org, and I will be happy to get you copies. And if you want to get involved at some level, reach out to me, and let's start a dialogue.
Great, thank you. And this question is for Janet from Practice Green Health. Janet, similar question, how can my company get involved in Practice Green Health?
If you're interested in joining the organization, please go to the Contact Us section, or the About Us, I should say, and go to Staff, and you'll see Stan Cahill is the Director of Membership, Stan Cahill. If you have any trouble, though, feel free to email me, and I'll direct you.
Great, thank you. And a follow-up to that is, do you support programs internationally?
You know, Practice Green Health is not an international organization, but we have an international arm, the Healthy Hospital and Global Green Network. And so I'm happy to make that connection as well if you just reach out to me.
Great, thank you. The next question is for Sarah. Sarah, there has been some controversy about LEED's position on chemicals, and I was hoping you could explain what's going on.
Sure. So some of you may have seen that we've been working with the American Chemistry Council and a lot of our joint member companies, large companies like Dow, BASF, DuPont, and Bayer Material Science, on some of the new credits that are in the design and construction rating system in the materials and resources section. We have been working diligently over the last few months to really come up with a solution that we hope works for everyone involved. if you're interested to see what that looks like, it's the third option in the material ingredients credit, also open for public comment right now. But in general, we are really trying to push the building product industry to a place where a lot of the green cleaning products have been for years. So this is an industry that doesn't really necessarily have the same kind of oversight or regulation. So we're hoping that we can incentivize manufacturers to start providing ingredient lists on what's included in their products, and then optimizing for safer alternatives to some of those products within their design formulations. All of that within the larger goal of really being able to assess products on a life cycle basis. So looking at environmental, health, and social impacts for our designers and architects.
Great, thank you, Sarah. Then we have another question regarding TransPair. Two of our presenters, I think, mentioned it, Mark and Sarah, and a number of people wanted to know what it is. So Mark, maybe you can start.
Well, I'll take a stab. TransPair is a program that's being launched by jointly by ISSA and Ecoform. It's essentially going to be I like to call it a nutritional label for the environmental attributes of cleaning products. So instead of having simply having a Green Seal or Eco Logo certification, in addition, there is the potential of having a information-based label that says this is the aquatic toxicity, this is the dermal toxicity, and it shows you more detailed information about those environmental and health impacts, endpoints that can help you make a purchasing decision. It doesn't replace certification labels by any means, but it does give a more robust set of understandable environmental health endpoints in a way that a ingredient list may be undecipherable to many. This would present these endpoints in a way that's kind of accessible. So we're hoping to see the launch of TransPair very soon. I know it's in beta testing right now, and we will see where that goes. And Sarah, if you have anything else to say, by all means.
No, that's great.
Great, thank you.
Hey, Alex.
Oh,
hey,
sorry.
Alex. This
Yes.
is Steve. Do you mind if I just make a comment about it as well?
Please, go for it.
Thank you. The thing that I really like about TransPair is, 10 years ago, there was literally less than a handful of manufacturers that use any type of third-party certification. But today, literally hundreds of manufacturers and thousands of products have been certified. And the challenge for a lot of schools or hospitals, and LEED does the same thing, the challenge that the purchasers have is every product has that kind of certification, or the vast majority of them. So some of these guys, like the schools, they don't want to just sort of have this pass-fail kind of certification, but if they're more concerned about effects on children, they want to be able to filter through those products and reward the manufacturers who have made their products even safer relative to maybe VOCs or other exposures that a child may have. Whereas if they're in a sensitive environmental area, a water area, the Chesapeake Bay area, those folks may want to increase the requirements around aquatic toxicity. So it really allows the user to sort of be able to identify the things that are most important to them. So it really is, in my opinion, the future of eco-labeling, and I think it's a really exciting step for our industry.
Great. Thank you so much, Steve, for adding that input. We have a question for Janet. Is Process Green Health planning on addressing the chemicals used for decontamination in the sterile processing department?
Yeah, this is an area where we are engaged both for high-level disinfection and for sterilization. And it's not just about the product itself, but it's also about the staff training and the design of the space and, adequate air exchanges and staff training, things like that. But yeah, that is an area that we discuss.
Great. Thank you so much. Anything else to add? Sorry. Okay, great. A question for Mark. Do you have any predictions about passing new laws on green cleaning in schools in either states or at the federal level? And maybe you could speak just a little bit about what the current state of state policy is for green cleaning.
Okay, yeah, absolutely, no problem. Currently 10 states have requirements or guidance at some level for green cleaning in schools, and I believe over 20, maybe 22, 23, have some form of governmental purchasing requirements or strategies for green cleaning in governmental areas. We don't see a federal mandate coming down the line by any means. These are local purchasing that's driven by a lot of state programs. At the federal level, we know the Department of Ed has a green ribbon schools that's encouraging green clean purchasing. The Department of, or I should say the EPA has their state guidelines for environmental health, which includes recommendations for green clean purchasing. So there are a lot of federal level recommendations. We also know that recently the National Association of State Boards of Education came out in support of green cleaning. However, these decisions are being made state by state. As I mentioned, there are 10 states with state policies. Every year we always see engaged and interested advocates trying to promote policy. We've seen advocates this year in Minnesota and Ohio and Maine who are interested in promoting policies. But again, it ends up being a state-by-state decision, and a lot of it is also driven by what are the current political constructs and budget issues in the states at any given year. I think we're going to continue to see movement, though, because we've seen a lot of interest and a lot of activity. And I wouldn't be shocked to say that the pace of state policies being updated to have schools adopting green cleaning requirements will accelerate slightly over the next few years. And maybe there will be some convergence around kind of national general recommendations and general standards. But that's what we hope to see.
Great, thank you. Another question for Janet, and then the other speakers might be able to chime in on the second half of this. How are hospital environments and certification agencies in accepting the non-chemical cleaning technologies?
I'm sorry, how are we accessing the technologies?
Accepting non-chemical cleaning technologies.
How are we accepting them?
Yes.
I think there's probably slow movement at the beginning, but then once hospitals have a place where they can share their successes, there's a great uptake. So that's how it usually is. Somebody will try it out, and then the word catches on, people share stories, and then we see it move more quickly from there. We do have, the early adopters in healthcare. We know where those places are where they're more likely to try out something new and innovative, pilot it, and then it picks up from there.
And this is Mark Bishop saying, and I would say there are areas of a school where we're not seeing it. That's in areas that are driven by public health issues, in the cafeteria setting and the school health services settings. But in the general cleaning, we're seeing a lot of interest in how can we reduce our chemical use. And in our Green Cleaning Awards program, which is a small subset of schools, and I don't think it shows broad trends, but it shows where leadership is going and where some of the key programs are. Most schools are at least trying out these non-chemical cleanings, and more schools like them than not, it seems. And there are a lot of different technologies out there, again, whether it's vapor and steam or ozone or the activated water. But in the general purpose cleaning, there is a lot of interest in learning more and trying to figure this out. There's no question that the costs have to come down, or some type of understanding of how these can be purchased, since they're more expensive up front. And we want to make sure that people believe the efficacy. We want to see a little bit more research showing that the efficacy is really there. But the interest is high.
Great, thank you. Another question for Sarah, which is a specific one, but hopefully you can answer it. Can a dilution control system contribute to a LEED point if it is not third-party certified?
Oh, that is a tough question.
And maybe if you could look into, then we can share that information with the audience after.
Sure. Yeah, it's certainly something that we would want to promote. I'm just trying to figure out where we currently recognize that technology. So yeah, I'm happy to follow up.
Hey, Sarah, this is Steve. Can I also sort of comment on that? Because I think the question perhaps was written in a way a little bit confusing. Chemical cleaning products can be a part of a program, of a LEED project, even if it's not been third-party certified, as long as the manufacturer can produce all the data, the test data showing that the product has been evaluated for the health, safety, performance, and other things that that sort of these certifications require. So as long as you produce the documents, which in some respects is a lot of work, but nonetheless, it can be self-certified as long as you have all the supportive documentation. And then, of course, having concentrates and using dilution systems with it is a part of it. But I just wanted to sort of put it out there that it doesn't limit to only certified products, although candidly the certifications makes it a lot easier for everyone to do the verification that the products meet the intention of the credits. Does that accurately sum up or present another sort of a pathway to achieving those credits?
Yeah, I would agree. You know, our reviewers are not experts in this field, so they would be the ones evaluating that information. So it's certainly faster for us to look for third-party labels, but we want to make sure that we're also recognizing really valuable strategies and techniques out there. So yes, I agree.
Great. Thank you, Sarah and Steve. I think we'll take maybe 2 more questions, just since we're about 15 minutes over now. So first, a question which any of the presenters can feel free to jump in on. How will you overcome becoming green when killing bacteria correctly involves disinfectant?
This is Mark Bishop, and I'll be happy to take a stab at that. You know, when we talk about green cleaning, we talk about protecting, about cleaning to protect health without harming the environment. And it's stated in a way that, in a very purposeful order. We clean to protect health. That's number one. We want to make sure our facilities are healthy for the occupants. And then secondly, we want to make sure we're doing it in a way that contributes to sustainability and the overall environmental footprint of our buildings and the way we run them. Having said that, we would not recommend or suggest doing anything that sacrifice public health. And we understand that there is appropriate and reasonable use of disinfectants. So when we talk about green cleaning, we don't talk about let's not use disinfectants. We talk about let's use the most targeted, least toxic, appropriate use disinfectants for the appropriate purposes. And in that context, we want to make sure it's targeted, it's not blanketing schools, it's not blanketing our facilities, and we are using them appropriately, and then cleaning first, educating second, and then using appropriate disinfectants in a reasonable times third. So they're part of a green cleaning program, but by no means they're part of a green cleaning program. They should not be prohibited from being used, but they have to be used judiciously. Hope that answers the question. If anyone wants to jump in, feel free.
Well, this is Janet. I'll just say that in general, doing any sustainability initiative anywhere, certainly I can speak for healthcare, that we would never do anything that would conflict with quality or a safety protocol.
Great, thank you. So final question is, what are safe and economical alternatives to chemical-laced products like Roundup?
This is Janet. I'm not an expert on sustainable landscaping, but we have connection to experts, and there is a chemical-free methodology, and I'll tell you that some of it is as simple as volunteers manually removing weeds from grass. We have some veteran administration hospitals that we work with where they integrate this kind of rehabilitation and work right into things like good old-fashioned hand weed removal. But there's a whole protocol for sustainable landscaping, and whoever is asking the question, I would be happy to point to those resources.
And I'll throw in at Healthy Schools Campaign is that we believe that we need to have sustainable operations. In green cleaning, we should include components of both integrated pest management as well as natural landscaping. We talk to a lot of schools that start to say, we're going to start not getting overly uptight about having some dandelions in our fields, and in trying to redefine what our standards are. And I agree. Some of it is manual control. Some of it is kind of scaling back what our objectives are for our weed control. And then the third is then looking at what those reasonable chemicals are. I don't have any specific product recommendations, but there are a lot of organizations that do.
Yeah. Great. Thank you so much. And Steve, I'll turn it back over to you just to close. I think that's it for the question and answer. So thank you, everybody, for sending in your questions.
Well, I just wanted to thank all of the speakers today. I really appreciate your time. And I want to thank all of you that are on the phone who spent some time with us. I truly believe that this group of 4 speakers really are the movers and shakers, the thought leaders in their respective areas. And I encourage all of you to try to engage them if you're not already doing so. And I hope to see all of you at Clean Med and the Green Sports Summit in Greenville this year. So with that, thank you very much for your time today. This concludes our webinar, and have a great rest of your day. And thank you all for your efforts.
Thanks, everybody. Have a good day. Bye-bye.
Thank you.